Hello there, it's Abbie Palmer, physical therapist at Promotion Physical Therapy in Rapid City. And today I just wanted to walk you through some exercises that you can do if you're getting ready to have surgery on your shoulder. So the first exercise I want to show you is what we call a wall crawl or a table crawl. Pretty simple, all you need is a counter or a wall and a pillowcase or a towel. So you're going to start here and you're just going to slide your shoulders forward until you go to that point of where you're losing the comfort, having any pain, and you're going to come back. And you're going to do this about 10 to 15 times. Other way you can do this is against a wall. So the same thing, you can have a towel or a pillowcase, and you can just trace your arms up and bring them back down. And this should just be a nice comfortable pace, not too fast, not too slow. So the next one I want to show you is what we call a towel internal rotation stretch. So let's say that this side is the side that I'm going to have surgery on. I want to take my other arm, I'm going to put the towel behind my back, and I want to grab the towel with my other arm, and I'm going to, using this hand, pull this arm up into a stretch. So you can start all the way down here, and you can pull it all the way up like so. So the next series I want to show you is what we call shoulder isometrics. So what that is doing is that it's taking all those muscles and it's allowing them to all activate, but without actually moving your shoulder through any range of motion. So you can do this pretty much anywhere. A doorway is really nice because you can change all the different directions. And essentially what it's going to consist of is that you're just going to be pushing into the doorway. And you're going to use about a 5-pound force. So it's not going to be pushing as hard as you can. Just kind of a light push. You're going to ramp it up for a couple seconds. So you're going to slowly increase that force for a couple seconds. You're going to hold for a few seconds, and then you're going to ramp it down and let it go and let it relax. The first way you can do it is by pushing forward. So your fist can go forward into the wall, hold, 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 and ramp off. Next way you can do it is by pushing out, like you're going to do some rotation. So you hold here, hold, 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 and relax. You can do the same thing going inward. On the other side of the doorway, push in, hold, 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 relax. You can also go backwards. So holding here, push back, hold, 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 relax. Lastly, elbow into the wall and you can go sideways. Hold, 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 relax. So with that, you want your shoulder in a nice neutral position. So we want that arm right by your side. Don't want it out here, up here, or back here. Elbow can be right by your side and you can be pushing with your hand or elbow in any of those directions. So the next exercise is going to be pretty simple. It's just going to be a shoulder blade squeeze. So you're going to be sitting, have your shoulders in a nice position, and you're going to be squeezing those shoulder blades in the back. So squeeze, 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 and relax. I'll show you that from the back. Squeeze, 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 and relax. Squeeze, 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 and relax. So with any of these exercises, the rule of thumb is that we don't want a significant amount of pain with any of them. So if you are having about 3 or 4 pain, some of that mild discomfort is okay, but if it's starting to creep up and ramp up into those higher levels of pain, just discontinue that exercise and move on to the next one. So while your shoulder issue may seem pretty straightforward, there can actually be a ton of factors that can go into what's going on with your shoulder. This can include posture stuff, it can include your neck, there could be issues in your upper spine, you could have issues with your shoulder blade mechanics, as well as your actual physical shoulder and arm itself. So the nice thing about this is that your physical therapist should be able to identify all of these factors that are going on for your shoulder specifically and make that a part of what you're doing with your treatment plan after surgery. If you have any questions or concerns or any significant pain with anything, or if you'd just like for a physical therapist to walk you through an individualized program before or after your surgery, go ahead and give us a call here at Promotion Physical Therapy, 399-9565.